Hi, I'm Dr. Claudia Kim, cosmetic surgeon here at New Look New Life. Today I'm going to be talking to you guys about a Halo Pro laser. The Halo Pro laser is a laser that's made by Cyton, and it is a hybrid laser. What is a hybrid laser? There's two types of lasers. One is an ablative and one is a non-ablative, and they do two different things. And so the Halo Pro is actually combining these two technologies to address different things and different concerns of the face. So what does a Halo Pro actually do? It actually helps to reduce fine lines on the skin, acne scars, large pores, or textural irregularities or roughness that people may feel on their skin. And what the hybrid function does is that the ablative function actually helps to kind of pulverize the first few layers of the skin or resurface the skin. And that'll help to smooth out the fine lines and also smooth out some large pores and to smooth out the skin with the irregularities and like the roughness. The non-ablative function actually goes in deeper and targets the cells that are responsible for stimulating collagen and elasticity. So when we use these two types of lasers together, you're attacking the surface and also stimulating the deeper layers of the skin. Now, who is a good candidate for Halo Pro? So obviously, if you are experiencing these facial concerns such as like the fine lines and the pores and the texture and the spots, the Halo Pro is excellent for helping to improve the appearance of these concerns. Who is not a good candidate for the laser? Because the laser is a very strong laser, there is a Fitzpatrick skin scale that helps us to measure the type of skin that you have and whether you are a or not a good candidate. I am a Fitzpatrick type 4, which means that I tan faster, or I tan rather than burn in the sun. Those individuals can have a higher chance of what's called post-inflammatory hyperpigmentation, PIH. And so any kind of inflammatory process that the laser forms actually has a darkening effect or can cause hyperpigmentation of the inflamed areas. And so individuals who are of a darker Fitzpatrick skin type, so the Fitzpatrick 4, 5, 6, we may not be good candidates for the Halo Pro. Fitzpatrick type 4 or baby 5, we can help to reduce the post-inflammatory hyperpigmentation by pre-treating the skin with hydroquinone, which is a prescription grade medication. It's a topical medication that helps to calm down the melanocytes, which are the cells that are responsible for producing pigment, and you prep the skin for 2 weeks before a laser so that the skin cells, the melanocytes, are actually kind of quieted down so that inflammation does not cause the hyperpigmentation afterwards, right? So that cream has to be applied for 2 weeks before at nighttime before you do any kind of ablative laser. The individuals that don't need to pre-treat are the Fitzpatrick 1, 2s, and 3s. And these individuals are much more fairer in their skin complexion. They may have lighter eyes, lighter hair color, and they generally burn first or they burn before they actually tan, because these individuals don't have as much of a higher risk for post-inflammatory hyperpigmentation. How do I prepare for the Halo? So again, if you are someone who is prone to post-inflammatory hyperpigmentation, your provider will prescribe you that hydroquinone cream to apply for 2 weeks prior to the laser. You also do have to stop using any retinol products. So if you are on any kind of oral retinoids, such as Accutane, you have to stop Accutane at least 6 months before the laser. If you are using a topical retinoid like tretinoin, you do have to stop it for 2 weeks prior to the Halo. And you do have to avoid any sun exposure. So if you know that you're going to have a very fun-filled summer at the beach, then maybe consider doing the Halo in the fall, because you do have to avoid the sun at least 2 weeks before and at least 2 to 3 weeks after the Halo laser. Now, what to expect after the Halo Pro? So everyone will experience a little bit of pinkness, like they've gotten a sunburn, or swelling for the first few days. Usually day 1, 2, and 3, you have kind of that redness and the swelling. On days 3 to 7, your body goes through what's called the MENS period, and that stands for microscopic epidermal necrotic debris, which just means that your skin is kind of scabbing off, and it looks like you took some coffee grounds and kind of applied them to your face. So from far away you look kind of dirty, but that will all start to flake off at about day 7. And so that usually the recovery or the appearance of having some kind of skin procedure usually all goes away after 7 days. After the 7th day, you'll notice this glow and this shine and this dewy texture after the halo procedure. But do remember, during that week when you are having the coffee grounds, do not scrub your skin, do not pick at the skin, and let the body just naturally slough off the MENS, or you can potentially have hyperpigmentation or hypopigmentation of the area. So no touching. What does the Halo Pro feel like? So generally we will apply a topical anesthetic to the face and let you sit and numb up for at least 15 to 30 minutes. Now after the numbing process, it does really help with the discomfort of the laser, and most individuals will feel like a warmth or kind of like a tiny stabbing sensation while we're addressing the areas of face. It is very tolerable, but if you are someone who is a little bit more anxious or do have a lower pain tolerance, there are other modalities that we can provide, such as laughing gas or some oral medications or some anti-anxiety meds, depending on your provider, to help to kind of ease that process. So the Halo laser can take up to about 45 minutes to an hour, depending on how many areas of the face that you will address. So let's say if you're addressing just the face area, it can take up to about 45 minutes. If you are addressing the neck or the décolletage, it can take up to about 90 minutes. And after the laser, you are going to feel the warmth, the heat from the laser itself. Usually it just lasts for about 20 to 30 minutes after the laser, and then when you exit the office, it definitely is not as noticeable. Now, what are the supplies that I need to get after the Halo Pro? So you will need to purchase a very gentle facial cleanser and lotion. So you can actually purchase these cleansers and lotions from the pharmacy. Cetaphil has an excellent product line so that you can wash your face and also moisturize your face after the procedure. When you start to feel the MENS at day 3, you may feel the roughness of the skin. Again, just make sure you very gently wash your face with the cleanser. So you'll be using the gentle facial cleanser and the lotion. And during the mensing period from day 3 to 7, you're gonna feel that rough texture of the coffee grinds. Just be very careful with that. Again, no scrubbing and no harsh pressure on that area, just enough to kind of clean your face in the morning and in the evening time. Apply thin layer of the lotion, and also remember to wear sunscreen, especially when you're leaving the house. And it is recommended to do the Halo at least every 6 months or every 12 months, depending on your concerns. So for me, usually I'll do one in the fall and I'll do one in the springtime. So I hope you guys learned a little bit about the Halo Pro laser. I highly recommend it for those who are good candidates, and it's an absolute staple in my skincare regimen. But stay tuned for other educational videos like this. Thanks.